Good morning, everybody, and I want to thank everyone for joining us today for this very important announcement, partnership announcement. This is government working for the people and getting end results. I was just down with a friend the last couple of days that just lost his wife to drug overdose, and it's not easy. But what can we do? In working together with the legislature and all these other great organizations we're going to announce is to continue to give a pathway for recovery. $2.3 million will be funded for education programs, treatment, recovery, prevention, all these targeting different things. These funds are going to make a meaningful difference in our community, improving people's lives and helping to break the cycle of addiction. That's what we're looking at, to break the cycle. So we do have a lot of great organizations, and some of them, second chance opportunities, Healthier Capital District, Albany Med, Albany College of Pharmacy, Lincoln Pharmacy, Colony EMS, Addiction Care Center, Catholic Charities, all being awarded well over $170,000 each.
We should not underemphasize the fact that we are here today able to announce these grants because of bold action that counties like Albany County under Dan McCoy's leadership, attorneys general, and other policymakers took to go after the corporations that essentially created this crisis because of their own corporate greed. To see that bold action yield the results of settlement dollars that are now being through a grant process offered to organizations, and we're going to hear from one in just a second, in order to treat and put together prevention programs and education programs and all of that apparatus. That's a great thing. It is needed and necessary. I don't think that any of us are probably immune to family members, friends, colleagues, neighbors who have been affected by what has stemmed from the over-prescribing of opioids and the ripple effects that have been generated.
Drug overdose deaths, they're unacceptable, and it's heartbreaking. And it is time to derive new ways to save lives. Our community is in desperate need for more than a conceptual idea. We need a reaction, and we got the reaction that would establish a new course of action and a lasting positive impact. This $2.3 million supports just that. 14 professional and these expert organizations are being given a pot of funding that will support individual missions to help our neighbors recover and revive.
In the 5th District, we've seen a great deal of opioid use and addiction, as have all of our districts been touched by this situation. This, however, is giving us real hope for real solutions, for real partnerships, for real changes that can be made in people's lives, because no one is immune from this crisis. The bravery that it took for the county to undertake this effort is no small matter. We greatly appreciate the work that has been done leading up to this effort and the funding that will go to the following recipients. I'd just like to recognize our partners as we move forward. Albany Medical College, Second Chance Opportunities, Healthy Capital District, Albany Medical College Center 1, Albany College of Pharmacy and Health Sciences Laboratory, Lincoln Pharmacy, Colony EMS, Addiction Care Centers of Albany, Catholic Charities, Care Coordination, CPESN, New York, IPH, Senior Hope Counseling, and Tide of Hope.
In addition to mental health awareness, the month of May is also Older Americans Month. So our awareness is Seniors Hope Counseling, which will use $87,000 grants to assign peer-to connections with seniors at Albany Med Emergency Room, which is so important when you see our older seniors being taken advantage of, to have someone there to help them through their fragile time at Albany Med. This money is being well spent, and I want to thank the partnerships for that too.
I wish to share how deeply honored we are to receive the County of Albany Mental Health Opioid Settlement Funded Community Grant and the profound impact that these monies will help in terms of our client population that is struggling not only with substance use disorders, but most often with comorbid medical conditions and mental health conditions. We have a collaboration with Albany Med and with Albany County Department of Aging, so this grant will nicely complement the work that we're doing with those two agencies and the Coast SOAR grant to allow us to have a peer placed at Albany Med ER. There are a tremendous number of individuals who are struggling with opioid misuse and are incurring a multitude of injuries resulting in high-cost utilization of ERs and inpatient facilities. So by creating a project whereby we could place a peer at the ER, our hope was to decrease this high rate of repeat admissions into the ER and inpatient units.
I do want to say thank you for everyone being here. Thank you for the partnerships. And again, it's not possible without working together, putting our differences aside, because this isn't about poor, rich. This isn't about certain community people. This is about everyone coming together, because this affects everybody. I don't care if you're poor, you're middle income, you're rich. They all have the same issues, and we're all dealing with the same topic. So let's work together to find solutions. So thank you, everybody.